Hi, my name is Crystal and I'm a student physical therapist. I will be doing a pediatric and infant neurologic examination. So before we begin the examination, we are going to gather information such as history of the baby. And for the purposes of this video, we're going to just focus on age, the type of birth, such as breech, and APGAR scores. APGAR scores will allow us to know more information of any initial issues the baby might have had at initial birth. And for the purposes of this video, the baby is 5 months old with a normal birth. So now we will begin the general physical. I'll start by measuring the baby's head circumference in centimeters. The best position to do so would be to lay the baby on the table. However, for the purposes of this video, I'm going to sit the baby in my lap. I'm going to start with the measuring tape at the back of the baby's head at the occiput. I'm going to go all around to the front of the baby's forehead, to the back, and I have a measurement of 41. Now I'm going to measure the length of the baby. Going to start again at the back of the baby's head and go down to the heel of the foot. And I have a measurement of 50. So now we're going to check for the general appearance of the baby. You want to look to make sure that the baby's joints are symmetrical, that the baby's eyes are symmetrical, and that the baby has symmetrical leg length. And this baby seems to be normal. And now you're going to check to see if the baby's hair is dry or soft. We'll now examine the back of the baby for any sacral dimples or tufts of hair. The baby seems to have a symmetrical and normal midline with no tufts of hair that may indicate spina bifida. And lastly, for the general physical, we're going to see if there's any presence of any unusual body odor. For example, salty body odor can be indicative of cystic fibrosis. So now we want to examine the baby's skull. We're looking to see if the head of the baby looks abnormally big, macrocephaly, or abnormally small, microcephaly. The last thing we will look for is any fontanelles, bulging. The baby seems to be normal. So now for the cranial nerve portion of this exam. We will begin with cranial nerve 1, olfactory. For this exam, you will need a peppermint scent or a lavender scent, any scent that is pleasant to the nose, and you will test the baby to see the baby's reaction. Because the baby is 5 months old, this test is applicable. Cranial nerve 2, optic nerve. It is best to use a shiny toy. However, for the purposes of this video, I'm going to be using a pen. I'm going to conduct the H test, looking and examining for visual acuity and visual fields. I'm going to be examining to see if the baby's eyes are tracking smoothly and together. For cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens, I will be checking the baby's reaction to light. It is best to use the pen light. However, for the purposes of this video, I will be using the light on my cell phone. As I shine the light on the baby's eye, the pupil should constrict. And as I remove the light, the pupil should dilate. Cranial nerve 5, trigeminal. I will be conducting the rooting reflex to test for sensation. I will stroke the baby's cheek, and the response and reaction of the baby should be suckling, anticipation for feed. I'm looking for symmetry. For the motor portion of trigeminal, you can use the baby's binky to activate masseter and temporalis. Cranial nerve 7, facial nerve. I will use a peppermint, place it in the baby's mouth to see if the baby's sensation is intact. The reaction of the baby will let you know that the sensation is intact. Cranial nerves 9 and 10, glossopharyngeal and vagus. This will be conducted near the end of the exam because this reflex is provocative and may inhibit completion of the exam. Cranial nerve 11, spinal accessory. I will turn the baby's head against light resistance using one finger. Cranial nerve 12, hypoglossal. To examine this nerve, I will observe where the baby's tongue moves when the baby is crying or cooing. For this portion of the exam, I will be testing for reflexes. The first reflex I will test for is the jaw jerk. With my reflex hammer, I will hit the hammer on my thumb. Next, I will test for biceps. Next, I will test for triceps, brachioradialis, patellar reflex, all reflexes will be tested bilaterally, and I am looking for symmetry. Any sustained clonus is abnormal at all ages. With a pen, I will be conducting the Babinski sign. Cerebellar function is part of the motor systems. So for this portion of the examination, I will have the baby lay on her stomach, extend her hands, and reach for the toy. I am looking for symmetry and coordination. Now for the sensory component of this exam. To test for sensation or light touch, I will use the bottom of the spoon on the baby's foot. I am looking for a response from the baby. Posture and muscle tone. In this portion of the examination, I will have the baby supine first, and I will turn the baby over to prone. In both positions, I will be looking for symmetry. And for the last component of this exam, we will be testing for primitive reflexes. Moral reflex, tonic neck response, plantar and palmar grasp reflex. As I mentioned earlier during this exam, cranial nerves 9 and 10, glossopharyngeal, and vagus, also known as the gag reflex, is a provocative exam. So, I will now conduct this exam. One should use a popsicle stick. However, for the purposes of this exam, I'll be using a pen, and I will place it at the edge of the baby's tongue.